Old Doctor's 11 early prostate cancer signs you must see. It could save you. Old doctors have long warned that the subtle signals our bodies send us can be life-saving if we listen closely. Today, I'm here to share 11 early signs of prostate cancer that these experienced practitioners insist you must recognize. These signs aren't dramatic alarms that burst forth overnight. Rather, they are gentle hints, small, almost imperceptible changes that, when noticed early, can lead to a 98% survival rate if caught in time. In the next few minutes, I'll walk you through each of these signs in a way that's both informative and easy to understand, so you can be proactive about your health and perhaps even save your life. Let's begin with one of the most commonly reported changes: alterations in urinary habits. As men age, it's normal for some urinary changes to occur, but a sudden increase in how often you need to visit the bathroom, especially during the night, might be more than just an inconvenience. Imagine waking up multiple times every night, unable to sleep through because your bladder insists on interrupting your rest. This frequent urination, known medically as nocturia, can be an early indicator that something is affecting the prostate. Medical research has shown that a sudden uptick in nighttime bathroom visits may point to early changes in prostate tissue. It's as if your body is trying to tell you, "Hey, pay attention to me!" Moving along, let's talk about a weak or interrupted urine stream. Many of us have experienced a strong, steady flow throughout our lives, but if you begin to notice that your stream has weakened or become intermittent, starting and stopping without warning, it could be a sign that the prostate is beginning to interfere with normal urine flow. The prostate surrounds the urethra, and as it enlarges or changes in structure, even subtly, it can restrict the passage of urine. This disruption isn't just a minor annoyance. Over time, it may signal that abnormal growth is taking place within the prostate. Next, consider the discomfort some men feel when trying to start or stop urination. Picture the frustration of having to strain each time you sit down or stand up to relieve yourself, feeling as though your body is working against you. This difficulty in initiating or stopping urine flow can be one of the earliest red flags. It's a physical reminder that the prostate may be undergoing changes that warrant further investigation. Many older doctors emphasize that while such symptoms might be brushed off as benign prostatic hyperplasia, BPH, when combined with other warning signs, they call for immediate medical attention. Now, dear viewer, let's move to another critical sign: the presence of blood in the urine or semen. Even a tiny trace of blood where it shouldn't be is a message from your body that something is amiss. While blood in these areas can sometimes be attributed to infections or minor injuries, persistent or recurring bleeding is a potential marker for prostate cancer. In numerous clinical studies, early prostate cancer has been linked with such bleeding, even if the amount is small. This isn't a symptom to ignore. If you ever notice blood, it's essential to consult your doctor as soon as possible. Let's now transition to a sign that might be easily dismissed: persistent pain or discomfort in the lower back, hips, or pelvis. Many men experience occasional aches, but a constant, unexplained pain in these regions could be a subtle early warning of prostate issues. The pain might present as a dull ache or even sharp, intermittent stabs that don't resolve with over-the-counter pain relievers. It's thought that as prostate cancer begins to affect nearby tissues, it creates pressure points that radiate discomfort to your back and hips. Several long-term studies have observed that chronic pelvic pain is one of the underappreciated early signs of prostate cancer. Continuing our exploration, we reach a deeply personal and often unspoken symptom: changes in sexual function, particularly erectile dysfunction. It's not uncommon for many to face erectile challenges as they age, but if you notice a sudden decline in your ability to achieve or maintain an erection, especially if this happens without any clear psychological or hormonal cause, it could be more than just a normal part of aging. The link between vascular health and erectile function is well documented. When blood flow is compromised due to changes in the prostate, the result can be significant difficulties in sexual performance. This is a sign that demands not only attention, but also a conversation with your doctor about what might be happening internally. Following that, let's address another critical aspect: a noticeable loss of libido. A reduced sex drive is sometimes brushed off as just getting older, but when it occurs along with other urinary and pain symptoms, it should raise a red flag. The hormonal changes brought on by early prostate cancer can disrupt your body's balance and diminish your overall sexual desire. This isn't just about intimacy, it's about your body's overall energy and vitality. A marked decline in libido, especially if it's sudden, could be an early warning that your prostate is affecting more than just your urinary function. We have unexplained fatigue and general weakness. While feeling tired can be a normal part of a busy life, if you're experiencing chronic fatigue that doesn't improve with rest, it could be your body signaling an underlying issue. Prostate cancer, like many cancers, can sap your energy gradually, leaving you feeling drained and unmotivated. It's as if your body is fighting an unseen battle, and this persistent tiredness can be an important, albeit subtle clue that something is not right. Let's now consider changes in bowel habits or discomfort during bowel movements. Although not as widely discussed, some men notice that they experience changes in their digestive patterns, such as constipation, a feeling of incomplete evacuation, or discomfort in the rectal area. The prostate's proximity to the rectum means that even minor changes in its size or texture can impact your bowel movements. This symptom might be overlooked or attributed to dietary factors, but when it appears alongside other signs, it warrants a closer look. Moving further along our list, another key indicator is the discovery of an irregularity during a physical examination. Many men might not realize that during a routine digital rectal exam, a doctor might feel a lump or detect an unusual hardness in the prostate. This physical irregularity, often described as lumpy or asymmetrical, is one of the most telling signs that something could be amiss. Although you can't perform this check yourself, knowing that such changes can occur emphasizes the importance of regular medical screenings. Then, there's the symptom of unexplained weight loss or a sudden drop in appetite. Prostate cancer can sometimes lead to a subtle shift in your metabolism, causing you to lose weight without trying. This isn't about dieting or exercise. This is an involuntary change, a metabolic signal that your body is undergoing stress. Unintended weight loss, particularly when accompanied by fatigue or a change in your energy levels, is a sign that should not be ignored. Next, consider the possibility of recurrent urinary tract infections, UTIs. While UTIs are more common in women, men experiencing frequent or persistent infections may be facing an underlying prostate issue. These infections can become both a symptom and a complication of early prostate cancer, indicating that the prostate is interfering with normal urinary function and allowing bacteria to take hold. Repeated infections, especially if they seem to come out of nowhere, should be a cue to seek medical advice. Throughout this journey, it's crucial to understand that each of these signs on its own might not definitively point to prostate cancer. They can also be symptoms of less severe conditions like benign prostatic hyperplasia, BPH, or infections. However, when you observe several of these symptoms concurrently, it becomes essential to consult with a healthcare professional. Early detection and treatment can dramatically improve outcomes, potentially saving lives. I encourage you to adopt a proactive approach toward your health. Regular screenings, open communication with your doctor, and maintaining a healthy lifestyle through balanced nutrition and regular exercise can all work together to safeguard your prostate and overall well-being. These 11 signs are not just a list, they're a call to action. Your body is sending you signals every day. It's up to you to listen. I hope this discussion has illuminated some subtle yet critical indicators that may otherwise go unnoticed. If you found this video insightful or know someone who could benefit from these tips, please share this with your loved ones on WhatsApp.